Our quality improvement research project looked at the value of rotation-specific guides for resident education and patient care during a pandemic. Our research team consisted of myself, Dr. Michelle Coughlin, acute care nurse practitioner Diana Ellert, and our faculty advisor, Dr. Eugenie Ritz. Residents grew and need to acclimate to multiple services. Effective dissemination of site-specific information is challenging. This challenge increased during the COVID pandemic as face-to-face instruction was limited. We performed a root cause analysis and found the problem as a lack of a structured guide. The purpose of our study is to evaluate the effectiveness of using a rotation-specific pocket reference guide to improve dissemination of evidence-based and rotation-specific practice information. This study also evaluates this tool's ability to increase participant comfort in their practice in order to improve patient care. We had two objectives. First, to qualitatively measure the effectiveness of information dissemination using a multiple choice pre-post test comparison, and qualitatively evaluate the medical residents' perception of increased efficiency, efficacy, and comfort using a pre-post questionnaire. For our methods, we conducted a prospective study evaluating 12 participants' use of a rotation-specific guide. Information was collected on the vascular surgery service at the Detroit Medical Center from November 2020 through February 2021. An informational guide was created with rotation-specific information including contacts, order sets, and common vascular diseases. This guide was distributed to medical residents, fellows, and students who were starting on the vascular surgery service after taking a pre-testing questionnaire. The inclusion criteria included medical residents that agreed to take a pre- and post evaluation and were on the vascular surgery rotation in the given time frame. Those excluded did not agree to be tested. A total of 20 pre-post questionnaires and tests were collected. The 10-question test contained an equal distribution of questions on vascular surgery knowledge and rotation-specific procedures. Participants scored were analyzed using a t-test, and significance was given for a Pearson's correlation coefficient p-value of less than 0.05. We had three materials, the first of which was our quantitative tool featured on the left, which was a test given to participants on the start and end of the rotation. On the right, our qualitative questionnaire, which evaluated residents' perspectives, and in the middle, the cover of our evidence-based guide. We found all categories of post-use scores were higher than those of pre-use, while the general outlook on rotation-specific guides and desire to improve providing favorable. There was significant improvement of quantifiable knowledge as participant scores increased on post-rotation testing, scoring an average of 88% compared to 58% pre-rotation. Questions regarding routine contrast dye orders, vascular lab orders, May-Thurner syndrome, and CEAP showed the most improvement. Shown here is a table of our results in order of significance. Qualitatively, participants reported an increased confidence in placing orders and a favorable outlook on guides for improved efficacy. This translates to a quantitative outcome of axillary staff reporting a decrease in incorrect orders. Interestingly, the post-rotation questionnaire indicated an increase in the reported preference towards learning with written material, as seen in green in the chart below. In the VARC model of learning, there are four main types of learners. Research has correlated that written learners have increased ABSITE scores. The ABSITE is a predictor of success on board exams. Our quality improvement research-driven inferred conclusions are that an increase in qualifiable knowledge leads to a decrease in operating room delays, increased patient safety, and increase in board scores. Also, that a decrease in incorrect orders or order delays leads to an increase in cost-effective care. Additionally, cohesive service instruction leads to an increase in resident satisfaction. Research has proven that a comprehensive order set leads to lower incorrect orders and less extraneous testing. This in turn translates to cost-effective care. Our research also showed a decrease in incorrect orders and can say that the vascular surgery guide increased cost effectiveness and quality of patient care. This project addresses the ACGME core competencies of patient care and procedural skills and system-based practice, as well as the Quest Special Interest category of cost effectiveness in healthcare. While the guide was created for the vascular surgery service at DMC, any service would benefit from their own site and service-specific guide. In conclusion, this study supports the implementation of rotation-specific guides to increase resident efficacy and improve cost effectiveness, especially during pandemic conditions where face-to-face group instruction is limited.